Honorable Minister of State for Health and Social Welfare, Dr. Tunji Alausa, after the inauguration of the National Tertiary Health Institution Standard Committee, in an interview with Eko Hot Blog TV, gave an insight on the role of the committee and their benefit to Nigerians.
Okay, so you just inaugurated a 12-man committee. What should Nigerians expect differently this time around?
It's actually a 32-member committee of National Tertiary Hospital Standard Committee. This committee is a creation of the National Act of 2014, saddled with a lot of responsibility. But more importantly, it's a committee that is created by the Act of the National Act to help regulate and maintain the highest level of standards in our federal tertiary hospitals. And this, as you are aware, we've laid out a 4-pillar agenda on how we want to revamp, revitalize, and rejig our healthcare system to provide meaningful and comprehensive healthcare to each citizen of Nigeria. The first part of our pillar is maintaining effective governance in our healthcare system. This committee would work, is part of that will work to help improve and ensure we have a high quality of healthcare in our tertiary hospital. And as we continue to expand, as the committee works to do their function, and once we get to a point, we would expand the role and get our sub-national government to actually begin to partner with this committee as well, so that we can also help to monitor, regulate, and ensure high level of compliance at our secondary hospitals as well, to complement what we're doing at the federal tertiary level. Okay, thank you.
Eko Hot Blog also interviewed the committee chairman, Professor Philip Abiodun, and a member of the committee, the MD of FMC Ebute Metta Lagos, Mr. Ademola Dada.
So as the chairman of the just inaugurated committee, what should Nigerians expect?
At the end of the day, let me just say that we expect that we'll be able to work in such a way that the standard of care in tertiary hospitals or health institutions will be so much improved upon that Nigerians will be happy. So that all these industrial actions, the distrust in the teaching hospitals, the standard, the care of the health workers, as well as the care for the patients, will improve so tremendously that Nigerians will not need to go outside this country for their health care. That is our plan, that is our mandate, so that to set up any tertiary health institution in this country, we must be there to make sure that standards will be maintained. Then we shall be giving something like certificates to the teaching hospitals, to the tertiary institutions annually. We shall grade them to see what level. The essence of the whole thing is that government will be more involved. We shall advise government on money that will be given on the demands, requests of these teaching hospitals and their requirements. And then any money given to them, we shall see how they spend the money in the interest, as I said, of the populace. That at the end of the day, the health situation of our Nigerians, pregnant, at birth, at every level, will be improved upon, which is very good for economic development also of this country. That is our main job. So look at the teaching, we look at the research, we look at patient care. That is our work, cuts across all levels, whether pharmacy, whether laboratory, whether records, whether nursing, whether doctor, administrative care of the patient, that the people will feel it, that there's improvement in the tertiary healthcare of this country.
Well, I'm Ademola Dada. I'm the medical director of the Federal Medical Center Ebute Metta, and a member of the National Tertiary Institutions Standards Committee.
Okay, so as a member of committee. What do you have to say about the committee?
Yeah, I mean, it's a very important committee. It's a creation of the law. There's the National Health Law, and the committee is an important creation of that law. And as you heard from the Honorable Minister this evening, okay, maintaining standards in our institutions, particularly the tertiary health institution, is one of the key objectives of the present leadership of the Federal Ministry of Health. The Permanent Secretary also stated that very clearly, and I think it's absolutely very important. It's something that should have happened many years ago, but it's good that it's happening now. We have the leverage now. There is the political support. There's enthusiasm on the parts of the member. It's an idea whose time has come. It's in the best interest of Nigeria. Delivery of quality care is very critical to any healthcare system. Okay, and this committee is therefore very critical to the healthcare system. And as a member of the committee, I am determined to play my own role and ensure that the confidence that the Federal Ministry of Health and the ministers have in the committee is justified. Thank you.
Comfort Olayinka, Eko Hot TV.